In this section, I'm going to talk about how family members can help their relative with panic disorder and/or agoraphobia. Even though having a family member with one or both of these anxiety disorders can be frustrating, family members can help the process of recovery in many ways. The first is by encouraging treatment. Medications and psychosocial treatments can help a person with panic disorder and/or agoraphobia feel better, engage in meaningful activities, and improve their quality of life. It's important for their loved one to first visit a medical doctor for a thorough evaluation. If possible, family members could also attend to help answer questions and to provide support. If medication is prescribed, family members can provide support in regularly taking those medications. Family members can also support attendance to psychotherapy appointments by giving reminders and providing transportation to the clinic. If the person with panic disorder and or agoraphobia is in therapy, it might be helpful for family members to talk with the therapist to learn specifics about the illness and how they can provide support. CBT includes homework assignments, and family members can encourage their relative to do the homework and even offer to help if relevant. For example, family members can help reinforce the concept that panic attacks are not dangerous and work with their relative to consider alternative, non-scary thoughts about the attacks. If the person is doing relaxation or mindfulness practice as part of treatment, family members can help by giving the time and space for their relative to engage in such a practice at home. Studies have shown that partner-assisted exposure therapy helps reduce symptoms of panic and agoraphobia. Family members can encourage exposure practice with their relative. If there are situations that the person is completely avoiding, family members can offer to initially accompany them into those situations, with the goal being that the person would eventually go into those situations by themselves. Lastly, family members can provide emotional support despite the fact that some aspects of these disorders can be quite frustrating. For example, a person with these disorders might avoid making plans. They might cancel at the last minute for fear of having a panic attack. They might frequently ask for reassurance about whether or not their symptoms are dangerous. Or they might have difficulty doing things that are easy for most people to do, such as going to the store, driving on the freeway, or going out to restaurants. Family members who understand that these types of behaviors are a part of the disorder may feel less frustration and more warmth and empathy toward their relative. A person with one or both of these disorders can affect a family member's mood. Family members may consider joining a support or therapy group. Counseling can often help family and friends better cope with a loved one's anxiety problem. The National Alliance on Mental Illness, also known as NAMI, is a great resource for finding support. Finally, family members shouldn't feel responsible for solving all the problems themselves. They can't. They should get the help of a mental health professional if needed. That concludes our brief overview of how family members can help a relative with panic disorder and/or agoraphobia. Thank you for joining me for the Panic Disorder and Agoraphobia Education Series. I hope you found it useful.